I think in this day and age, like there's a lot of people. I will classify patients into big groups. You'll say the professional competitor who actually gets paid to compete, and then you have like the what we like to call the weekend warrior, where this group of patients that they really take pretty serious their sports, and they try to endure on a regular basis. In terms of, I mean, their shoulder injury, I think that one of the single most common problems that you're going to have is going to be a lot of tendonitis of the rotator cuff, biceps tendonitis, especially overhead activities when we talk about, baseball players, tennis players, lacrosse players, swimmers. Believe it or not, I mean, the compound a lot of important this type of sports has a lot of exposure to a specific the shoulder joint, and the overuse is a big portion. I would say overuse and abuse from the patients. I would probably say that in my practice, I see a lot of rotator cuff tendinosis, tendinopathy, and even a rotator cuff tear. I think biceps is a kind of an underrated part of the body, but with a clear new understanding, I mean, we know this is a pretty important source of pain, and a lot of the patients have to learn to differentiate between the rotator cuff and the biceps. And then, I mean, we then come across a little bit of instability. We know that younger kids, especially football players and Pee Wee leagues and even high school and college, dislocations or instability also play important role, especially because when people get unstable, there's a really high likelihood, especially the younger you are, to have a new instability event. So that's another important. And I would say finally, we all love to go to the gym, and I believe that the acromioclavicular joint, sometimes, a lot of the weightlifters out there that they love to go to the gym and do bench press and overhead, squats, and they love to, do, decline, incline, and dumbbells, heavy weight. We're going to start seeing a lot of that, acromioclavicular joint osteoarthritis and pain. When you talk about treatment of shoulder injuries, it is very important in this time to always understand clearly where the patient is coming from. What I mean about this is, like, you have to understand if the patient is a high competitive, is the patient is on a scholarship, is the patient is just a weekend warrior, or just a regular average, person who loves to play sports. With this in mind, you're going to have like a clear understanding of expectations and and a better approach to the injuries. Also, I think another broad, interesting concept is that everybody have to understand that sports medicine is a specialty that we always try to avoid surgery. I believe it's important for us that the non-surgical treatment should be always emphasized first, and do everything that is possible to avoid surgery. And as a last resource, we will proceed and restore anatomy and function with doing an intervention. I think when we talk about the pretty broad topics in shoulder injury, not all the rotator cuff tear needs to be fixed. I think well indicated rotator cuff injuries for fixation, it's an important part of a sports medicine treatment, especially when we talk about ages, older people versus younger people. Same way, arguments can be built about treating younger individuals with instability or glenohumeral joint dislocation, tendency to be more aggressive. I would say we get worried about younger people that we know have a chances or a long-term commitment to their joints, so they can continue their careers or at least their recreational sports.